So the biggest question is now, can we prevent this? So why I am asking for last half an hour this is axial spondyloarthritis, this is ankylosing, this is because the main aim of the treatment not to allow the patient to go to ankylosing spondylitis or radiographic sacroiliitis. So can we prevent it? So this is my photograph for the patients, because whenever I see patients, this picture is in my desktop. Patient asks me, sir, why I should get treated? What is my diagnosis and this thing? I tell, don't understand too much. You'll be in problem. You have to need a tablet or sleeping tablet. You just understand this, why you are treating. So this is, what is the difference? This is press. So this is still somewhat, this can be reversed. So start rotating this thing, doing exercise and everything. Give good anti-inflammatory drugs. This can be reversed. But this you have to only break. Okay. To halt the disease progression, I have already shown you that this follows. There are three aspects. One is inflammation. That will come as pain. Number 2 is fat metaplasia. Number 3 is new bone formation. And this also, if you can, MRI, active inflammation, osteal inflammation, this is fat metaplasia. I think it's very difficult for you, because this is not a star image. Star image, this will be very bright. And these are the new bone formation or syndesmophytes. Okay. So this is your IPL chart. This is the most important slide to remember from CME. That I have told you that the disease course follows a very variable path. And the pain comes and goes. That's why this disease is so difficult to diagnose. That's why the patient directly land in ankylosis. You have to tell them that don't target pain. Pain only will come in the winter for some days, and then the patient will be pain-free and patient will be moving around. So that's why they often miss the consultation, or they don't come in time. This is what is pain, on and off, inflammation. But whenever there is no inflammation or pain, but still once started, the fatty degeneration and new bone formation are relentless. So they progress just like today's CSK, and this score is like this. Only 100 and something. But this is like Hyderabad score. All the time going up. So whenever there is no inflammation or no pain, still your new bone formation and fatty disease is going. So the only way to prevent that is adequate treat to target and the adequate control of inflammation from day one. So this has been seen that if you are controlling the inflammation after 15 years, still there is a stabilization. And if within 5 years, if you control the inflammation, there is no inflammation because of your treatment, then the fat degeneration and new bone formation will not happen. So definitely we can retard the progression of new bone formation and fatty degeneration. Okay. So that's why, like every other disease, we have a window of opportunity. If you cannot explain this to your patient, you can never treat a spondyloarthritis patient. This has to get imprinted on the mind of the patient. That why you are treating, that this is the time, whatever best treatment you have to bring in when there is fire. Once there is damage, there is hardly anything you can make by giving a biologic or giving something. So don't waste time of a spondyloarthritis patient. That is very vital. So what's there in a name? I think Confucius has told the right thing, that the beginning of wisdom is to call things by their proper name so that you can plan. It is okay. So SS classification has made it very simple, that this is axial spondyloarthritis or peripheral spondyloarthritis. HLA-B27 is not equal to spondyloarthritis. Demonstration, objective demonstration of sacroiliitis by X-ray or MRI is the most important, not HLA-B27. Early intervention retard the disease progression. And ankylosing spondylitis is an advanced state of disease. So don't become very excited if you are able to diagnose somebody as ankylosing spondylitis, because everything is gone. The train has already left the station. And patient education and physiotherapy are very, very key. Please address the disease before it becomes very late, or else it will be very too late, actually not little, too late to stand upright.